Heyo, Jess Reynolds here. You know, over the years, a huge portion of my client base has become other practitioners, and I see the exact same injuries over and over again. Shoulders, thumbs, and necks for the most part. The bummer is, most of these injuries and issues, they can be prevented with a super simple home care routine. So today, I'm really excited to share with you part of my daily routine that's been incredibly helpful for me and many other practitioners. It's a super straightforward movement routine, and it's from my Self-care and Burnout Prevention course. What's great about this, though, is I'm offering this entire course totally free, and it's also worth 1 CE hour, and you get a certificate of completion. You can access the full course through the link in the description. But for now, let's dive into my full start of day movement routine right here. To start my day, I always like to begin with a strong muscular activation throughout the entire body. It doesn't take very long, but it really energizes me and makes sure that I feel strong and stable throughout the day. So let's go through that practice now. We're going to start with the fingers, move up the arms, go into the shoulders, the neck, head, jaw, and then move down the body. You could do it in a standing position, or if you want to, you could do it laying down. So with the hands, I'm going to bring them to my side, and the first thing I'm going to do is open them up as far as I can go, and then I'm going to be flexing my wrists and extending my wrists simultaneously and really trying to get those flexors and extensors contracting both at the same time. Not letting my fists close, but also not letting them open up all the way either. Now I'm going to move into my biceps and triceps, and I'm going to try, and you see I'm starting to shake already, I'm going to try and flex my elbows and extend my elbows at the same time, making sure those fingers stay contracted, and then relax. All right, so we really only work on one aspect at a time. Next, we're going to move into the shoulders. So for the shoulders, I'm going to bring my arms out to the side slightly, and I'm going to imagine I'm abducting at the same time as adducting. So I'm going to just fight myself in this movement, and these are isometric contractions as I try and abduct and pull my arms back down. And again, you can see how I'm shaking. It really is a lot of work, and then I'm going to relax. Then I'm going to move into my head and neck. And I'm going to try and rotate to the left at the same time pulling my head to the right, and then rotate to the right, pulling my head to the left. Now it looks like I'm just standing still, and I am indeed shaking a fair bit because I really am trying to isometrically contract. And you can hold each one of these for 10 seconds, 20 seconds, or 2 seconds. Really, it's up to you. The whole idea is to activate. Next, I'm going to move into my core, and I'm going to start to contract my abdominal muscles, and you can see as my body wants to curl in. But at the same time, I'm going to pull myself back up, extend my back, hold my chest in an extended position, really contract all through my core, and then relax. Now I'm going to go for my toes up. So with my toes, I'm going to curl my toes into the ground. I'm going to pull my feet down into plantar flexion, also trying to pull it into dorsiflexion. And I'm going to pull my legs in, adducting my legs and abducting, flexing my knees, extending my knees, really contracting my whole lower body, and then relax. And that's really all it takes, is a very quick movement through the body in which we contract all of our muscles simultaneously. Meaning we try and contract an agonist and an antagonist at the exact same time, and it activates everything. Additionally, what you will find is after this exercise, there's a good chance you're going to feel a little bit stronger. And I would encourage you, as you go through your routines, to keep that in mind. Maybe you're pushing down and you're using your extensors, your elbow extensors, your triceps, and you're extending your elbow as you push down. Well, imagine if you were to be trying to pull up at the same time. And this concept of using antagonistic muscles really, really allows you to feel stable and strong in your body. Yep, it definitely takes a lot of energy to do so, and it's not something I would encourage you to do all day, but occasionally, here and there through massage, just check in and do a muscular activation activity. So after you've done your muscular activation, I like to go through a very basic mobility exercise, primarily focusing on my upper body. So I'm going to start with my shoulder. The first thing I want you to do is take your arm and hold it just out in front of you. Now, as we go through this movement, I don't want you to rotate your torso. You're really going to keep those shoulders in the exact same position. So with your arm out in front of you, reach forward as far as you can. Again, without rotating your upper body. Really just focus on protracting that scapula as far as you can. Now, maintaining that protraction, you're going to bring your arm into full flexion, and once you get to the top, really try and reach and touch the ceiling. Now externally rotate that shoulder. Bring your arm back behind you into extension, and then bring it back to your side. Feels good. Now let's do the other side. So the same thing, keeping your shoulders as straight as possible. Bring your arm into flexion. Reach forward, protract your scapula. Don't let yourself rotate. And then as you bring your arm up all the way to the top, really try to reach towards that ceiling. Externally rotate the shoulder. Bring your arm back behind you, and I feel a nice big stretch in my chest. Bring your arm back to the side. Great. Let's do the neck now. So for the neck, I'm going to do very basic rotation, flexion, extension, and then I'm going to rotate and circumduction. So to rotate to one side as far as I can go, the other side as far as I can go. Gonna flex down, full extension, and then just some circles. Good, excellent. Let's move into those wrists. So the same thing, we're gonna take those wrists to the full range of motion that you have available. So go into flexion, extension, and do a bunch of circumduction rotations. I like to do both wrists at the same time. Now we're going to do some stretching for the forearms. These are nice and easy. First off the flexors, take your both hands, put them together like so, and then just draw your hands down this way. Now this is something that we do in climbing a lot to stretch those flexors. If you do not feel a stretch here, fine. Come from the bottom, take your hands in front of you like this and pull up into a stretch. Main idea is to get a stretch through those flexors. Let's do the extensors next. The extensors can be a little bit tricky. So what you're going to do is just take your hand out in front of you like this, and you are going to put one thumb on your palm, and you're going to wrap your fingers around the top of your hand just like so, and then pull your wrist towards your body into flexion. That may be enough. You may not need to do anything more than that to feel a stretch in your extensors. However, I certainly do. So what I will do in this position is I'm going to now take my shoulder, and I'm going to immediately rotate my shoulder so my hand is pointing out. And I'm going to hold that position. Now my shoulder is in medial rotation. With my shoulder staying in medial rotation, this is where it gets tricky, I am now going to supinate my forearm. So you can see how my elbow tries to go into supination with my wrist held in flexion. And it looks like an awkward position, it kind of is, but that position of holding the shoulder in medial rotation by pinning the hand and then supinating the forearm strongly stretches the extensors. Now, of course, as you go through these motions, if it hurts your wrist, don't do it. Don't do it. If it causes you any pain at all. If it doesn't, ideally you do stretch them. Now, after I've done my stretching, I like to do a little bit of traction. I'll just hold on to my wrist like so, pull out, and then just do a little bit of pronation and supination and shake it off. And we could do the same thing for the other side. So we're going to take that forearm out in front of us, flex the wrist. I'm going to immediately rotate my shoulder and then supinate my forearm. Again, you can see how that elbow goes into supination. Supinate that forearm. I'm gonna relax, do a little bit of traction. So I just hold around my wrist, pull my wrist forward, retract my scapula, do a little movement, give it a shake. Awesome. So that's really what I do for the entire upper extremity. And this demonstration took a lot longer than it actually takes to practice. Again, this is no more than a couple minutes tops. So let's do a quick strengthening exercise for those forearms. We could do this either on the mat or you can use a wall as well. So I'll just go down on the ground like this. If you're comfortable to do so, go for it. If not, you could do this exact same thing with your hands up against the wall. So I'm just going to put my hands in front of me just like this. With my hands in front of me, all I'm going to do is just flex onto my fingertips and then go down. That's it. So I'm just flexing my wrist and letting my wrist go slowly back down. Now, after 5 or 6 of these, you'll probably feel some burning in those forearms, and that's fine. That's as far as you go. The position of your body as far as how forward and back is going to make it more or less challenging. So if I move forward like this to my wrists in extension, and then I go up on my wrist, it's quite hard. If I want to make it a little bit easier, I just sink a little bit further back. So you can progress the difficulty of this by either moving forward or moving backwards, and that's going to be working on the flexors and extensors. Now the reason it's the extensors, of course, is these are antagonistic. We can't flex our wrist without our extensors going, but it is primarily working on those flexors, a little bit on the extensors. Good. So for the lower body, I like to keep it nice and simple. Mostly going to be stretching my hamstrings, my quads, and doing some ankle rotations. So for the hamstrings, I like a classic forward fold, and you only go as far as you can go comfortably. I usually keep my feet a little bit more than shoulder width apart. As far as the position of my toes, I like to keep my second toe pointing straight forward. And then from there, I'm just going to bend my knees slightly. I really like to start with bent knees because if you know your fascial lines, you know that the superficial posterior line locks out anywhere else in the line if your knees are extended. So bend those knees ever so slightly. And then I just hinge, of course, at the waist, going to the point where I feel a stretch in those hamstrings. And then once I do feel that stretch, I bring my knees into extension. But again, they're still not fully locked out. I feel a nice stretch in those hamstrings. And I'll typically hold it for about 10 seconds. And then I'll relax, bend down, and I'll do that 4 or 5 times. So that's going to stretch out my hamstrings. Again, I'm keeping this very simple. Next, I'm going to be working on my quads. Myself, for my quads, I've got good balance. So all I'll usually do is just bring one foot up, hold on to it, bring my heel towards my bum, and then I'm going to push that knee towards the ground. That's the important part, really trying to touch the ground with that knee. As strange of a movement as that sounds, it's a really good mental cue to get a strong stretch in those quads. And then I'll move to the other leg. Now, if you don't have the right balance, no problem. You can hold onto a wall or a chair or something like that. And again, I'm going to push that knee towards the ground. And as I'm sure you know, I do like ankle stuff. If you haven't checked out our ankle course, please do so. But what I do for my ankles is I'll just drop into them and do a little bit of bounce on my ankles and then some controlled articular rotations of the ankle. Just move them through their full, happy range of motion. And then just wiggle my hips around a little bit, do a jump, and I'm ready. So that entire routine, going through the entire upper body, lower body, including muscular activation, really that's no more than 5 minutes, and I'll just do that once a day. Yeah, it'd be great. Do your 30-minute, 1 hour long full stretching yoga routine. If that's what you want to do, go for it. But the reality is, most of us, we have a hard time fitting in 5 minutes of movement into our otherwise busy day. So let's keep it simple, let's keep it short. And again, I encourage you to do that every single day before you go to work. And if you can, every single day, regardless of whether or not you're working. The job of a massage therapist, it's physically demanding. Of course, we're going to be using a lot of upper body strength, but what I always say is power comes from the core. And that's what we're trying to do, is deliver power. You're going to wear out if all you try and do is use your upper body strength. You really want to keep that core strong. This also helps prevent a lot of those other body aches that we see, like low back pain and hip pain. So I'm going to teach you how to do a very simple core strengthening exercise. And this is something, again, I would encourage you to do every single day, and it doesn't take long. Now this is called a hollow body progression, and we start with a very simple part, that's called a dead bug. So you'll lie down on your floor or the mat, whatever you have, nice and easy. And to start with, you're just going to bring your knees up like this and bring your hands up in front of you like that. So maybe this is as far as you can go. We're going to keep that back flat on the ground. Man, that's an essential part. Keep that back flat on the ground. If at any point in time you feel that back coming up, then that's not the right spot for you. We only go to the point where that back can stay flat on the ground. So in this position, the first thing we're going to be doing is I'm going to take my left leg and I'm just going to bring it straight out, keep my arms straight up, bring it in, do the same thing with my right, and bring it in. And if I can do that nice and easy, great. I'm going to bring my arms into the equation now. So now with my left leg out, I'm going to bring my right arm down and bring it up, and then I'm just going to switch. Takes a little bit of coordination. And if you could do that, just fine. Then we're going to move on to the next level. Remember, that back stays flat on the ground. So maybe you go to do that position and you see that back coming up. Well, you can't do that one then. You just move until that back comes up and then really push that back flat on the ground. So we really need to keep that back flat on the ground. So let's make this maybe a little bit more difficult. The next thing we're going to do is just keep those arms where they are above the head and just start to bring both legs out. And maybe you see I'm just barely extending those hips and knees. And maybe that's as far as I can go before my back starts coming up. And if that's the case, fine. I hold for 10 seconds. Then I bring it back. And then I go into that position again until I feel that back starting to come up. And then I flatten that low back against the ground and I hold it for 10 seconds. Now, if you can move a little bit further than that, then you do so. Maybe your legs come all the way out straight like this and that back stays flat on the ground. That back has to stay flat. And then we're going to hold for 10 seconds. And if your back starts to come up, then you just back off a little bit. It's super important. Keep that back flat. I know I'm repeating myself, but I can't overstate how important that is. All right? So maybe you can do that just fine. Maybe those legs go out, no problem. You can hold it for 10 seconds. You're like, yeah, I'm feeling a little shaky like I am, but I can do it. Let's make this a touch more difficult then. So we bring those legs out, we bring those arms over the head, we bring the shoulders off the ground, and we can hold this. Now this is called a hollow body, and we want to hold that for 10 seconds, and you'll really feel it in the core. And then we can come back up into that starting position, and you'll hold it for 10 seconds. Now as I do this, I practice this every day, so it might look a little bit easy, but I can assure you it's not tremendously easy for me. So maybe this is as far as you can go, and that is fine. You don't need to jump straight into this hollow body position. You really just need to strengthen that core, keep that back flat. You should feel tension here on your flanks, and this is going to be on transverse abdominis and your obliques. This is where you should feel some tension. You might feel some burning on rectus abdominis, but that's really the entire core that we're talking about. So that is called the hollow body progression. And again, I do strongly encourage you to do that every single day. And the whole process shouldn't take you more than a minute. As you saw, you hold it in 10 seconds, you bring it back, you hold it 10 seconds, you repeat that 3 to 4 times, and that's less than a minute. So all in all, from doing our stretching and our strengthening exercises that you should be doing every single day, you're maybe looking at 7 or 8 minutes. All right, so thanks for watching. I really hope that this routine brings as much value to your day as it has for mine. Remember, the full Self-Care and Burnout Prevention course is available for free, and it's packed with way more valuable insights and tips just like this. Plus, you do get that 1 CE hour and a certificate. Check out the link in the description to learn more. And if you found value in this video and you want to learn more about how to build a practice you love and the skills that sustain it, please like and subscribe and share your thoughts in the comments. Take care and keep nurturing your practice.